Do you often notice that even a small cut takes forever to heal, or your child keeps getting strange infections without fever? What if I told you that sometimes the problem isn't germs being too strong, but the body's soldiers, white blood cells, can't reach the battlefield? That's what happens in leukocyte adhesion deficiency, LAD. Think of it like firefighters who get the emergency call, but can't leave the station because their trucks won't start. Your body sends white blood cells to fight infection, but in LAD, they can't stick to the blood vessel walls and move to the injured spot. So even a small wound can become serious. Scary, right? So what causes this breakdown in communication? LAD is caused by a tiny error in your genes, specifically in the instruction manual your body uses to build certain proteins. These proteins act like glue tags on the surface of white blood cells. Normally, these tags help the cells grab onto blood vessel walls and crawl out to where they're needed, like Velcro on superhero boots. But in LAD, the Velcro doesn't work because the gene that builds it is broken. It's usually passed down from parents who carry the faulty gene without showing symptoms. So if both parents carry it, there's a 1 in 4 chance the child will get the disease. It's like both parents passing on a typo in a recipe. Suddenly the cake won't rise. Imagine your toddler has a small gum infection after cutting a tooth. Instead of healing in a few days, it turns into a large sore that won't go away. No pus, no redness, and oddly no fever. That's a classic sign of LAD. Because white blood cells can't reach the infection, the area doesn't swell up like it should. Other signs: frequent skin infections, mouth ulcers, slow healing of the umbilical cord after birth. It might stay on for weeks, and repeated lung or gut infections. Parents often say, "But my baby doesn't act sick," yet the infections keep coming. That's the trick: the body can't mount a proper defense, so there's no classic battle mode response like fever or swelling. How do doctors find out if it's LAD? They start by asking, are infections common but oddly mild in appearance? Then they do a simple blood test to count white blood cells, which often show very high numbers because the cells are stuck in the blood and can't get out. Then comes the flow cytometry test, a fancy machine that checks if the glue tags, like CD18 or CD11, are missing on white blood cells. For treatment, antibiotics are used to control infections, and in severe cases, a bone marrow transplant can be a cure. Think of it like replacing a broken team of workers with a new, fully functional team. There's no quick pill yet, but keeping wounds clean and preventing infections is super important. It's like living in a germ-aware bubble, but not too extreme. Since LAD is genetic, you can't catch it like a cold, but you can prepare. The best prevention is genetic counseling for families with a history. If you've had one child with LAD, testing future pregnancies via amniocentesis or chorionic villus sampling can reveal if the next baby carries the gene. It's like checking the software code before launching the app. Also, newborns in high-risk families can be screened early. Early diagnosis means early care, like having a fire extinguisher ready before a spark happens. Simple hygiene, avoiding crowded places, and quick treatment of any injury help too. Prevention here is less about lifestyle and more about smart planning and awareness. Now here's some hope: science is moving fast. Scientists are working on gene therapy, fixing the broken gene inside the body's own cells. Imagine sending a tiny correction note to the body's factory so it starts making the right glue tags. Early trials show that by taking a patient's bone marrow cells, fixing the gene in the lab, and putting the cells back, they can restore function. It's like editing a single typo in a huge book, and suddenly the whole story makes sense. Another advance is better matching for bone marrow transplants using unrelated donors or cord blood. Researchers are also creating lab models to test new drugs faster. While not available everywhere, yet these advances mean kids with LAD may one day